consultant surgeon at University College Hospital, Khalid Dawas, who joins us live from London. Khalid, thank you for your time this evening. Until recently, you were in Khan Yunis, I understand, in the south. You've also worked at the Al-Aqsa Hospital. You've seen firsthand the devastation there. How clear to you is it that what you've witnessed is genocide?
Well, what I can tell you is what I saw, and I think it's very easy for many people to make their own minds up about what this means. The definition of genocide, I think we all know. What I saw on a daily basis was driving from the home that we were staying in to the hospital were queues of people trying to fill up their tanks with water. There's no water in homes. What I saw was no electricity at nighttime, complete darkness. What I also saw was that the hospital casualties were overwhelmingly made up of children, women, and men who were civilians, quite clearly civilians. And what I also saw on the way back home was the mass movement of people heading south, even from Deir al-Balah, which is in the middle of Gaza, down towards Rafah. And this mass displacement was happening on a daily basis. And I think what all this told me, and what I think anybody who's witnessing this as firsthand as I did a couple of weeks ago, is that there is a change in the way that people can live their lives in Gaza. Gaza is unlivable at the moment. And I think this probably constitutes the definition of genocide.
And Khalid, what do you hope will be the outcome from this ICJ case being brought forward by South Africa? How hopeful are you?
Well, I can talk to you on behalf of the many Palestinians that we mixed with and met during the 2 weeks that we were staying in Gaza. And the overwhelming desire is for a ceasefire, not just because it brings peace to their personal lives on a daily basis, but nothing can happen without a ceasefire. From my point of view, working as a doctor in Gaza, you can't start treatment of patients because there is no equipment. There's not even any water for us to wash before we operate on patients. We were having to sterilize our hands using alcohol gel rather than water and soap because there wasn't any at the time. And I think so the overwhelming desire is for a ceasefire. And beyond that, I think there has to be a message that no nation on earth will, wherever the support comes from, can do what it can or what it wishes to do with impunity. And I think that message has to be said very strongly and very clearly. And I'm hoping that the International Court of Justice will come out with this message. I'm not a lawyer myself, but I think by speaking on behalf of those Palestinians that I met, and with the feeling that I have that we want justice, we want some kind of peace for those people who live there, the 2 million people, that is what I would like.
And Khalid, I hope you don't mind me asking quite a personal question. With conditions as desperate as they are, as a surgeon, how do you choose who you treat, and how have you coped? How are you coping with the trauma, if you do indeed feel traumatized by what you've seen?
The choices that we have to make, and I'm not unique in this. I'm one of many doctors in Gaza who would have had to make those decisions. People working in the emergency department, people who are surgeons, others who are not surgeons, having to make decisions as to what, in very crude terms, is salvageable, and we're having to define people as being either salvageable or not salvageable. And what I mean by that is that when you have, as we were having on a regular basis, hour by hour, scores of people being brought into the department. And this is just one small hospital in the center of Gaza. And you have to look at them very fast and decide, is that injury something that we can deal with in this hospital? Not is this injury something that we can deal with as doctors, but rather, does this area have the means and the capacity to deal with this injury? So as an example, people who come in with a head injury, where we could not get into a scanner, we have no idea what the severity of the injury is. Combine that with something else, like an abdominal injury from shrapnel, for example, which is very, very common. You put those two together, the chances of survival, unless they go to surgery immediately, but usually preceded by some kind of very accurate scanning to get to know so that we know what we're dealing with. Those kind of things, when you're comparing that kind of patient to somebody perhaps who has a single injury into the abdomen or into the chest, then you have to make a choice. And that choice is you go with the patient who you think you can save much faster and also much more reliably than with the patient that you can't. Those are the kind of choices that we never have to make in any Western healthcare system, but we were having to make those in Gaza on a daily, hourly basis, and really was quite heartbreaking. How do I deal with the trauma of what I saw? I think I am strengthened by the people that I saw over there. Certainly, I think anybody going to Gaza nowadays will be traumatized by what they see. I was working with people who've been doing this day in, day out for the last 3 months. And I must say that leaving Gaza, I left with a lot of guilt because I felt that I was leaving those people behind. The strength that they showed me is an inspiration to me. There's no doubt about it. And when I feel that I perhaps get a little bit emotional describing some of the scenes that I saw and some of the stories that I came across or heard, I have to remember them, and I remember that they have to live through this. I am able to get out after 2 weeks and go back to my normal life, and that gives me a lot of strength. How they respond to this.
Khaled, unimaginable. I really do wish you well. Thank you for your time, for sharing your experiences, and for everything that you've done and do. Really appreciate you sharing your experiences there with us. Khalid Dawas joining us live from London, a consultant surgeon at the University College Hospital.